friends, welcome to our channel. Feel free to grab some popcorn, freshly squeezed juice, coffee, tea, whatever you prefer. Sending hugs to you all. We're filming videos about the treatment of the musculoskeletal system. Basically, that's what we do as a whole. At the moment we're recording, we're documenting everything. In general, we will film manual therapy. A patient came to us. Her name is
Alla. Hello.
Alla. It's very nice to meet you. Alla did not come empty-handed. Disc, unfortunately, we don't have the disc with us. Forgot. Well, never mind, but we have a conclusion. Alla, please tell me what's bothering you, and next we can get straight to the point.
I am bothered by pain in the cervical spine. I had an MRI of the cervical and lumbosacral spine. A protrusion was found and a hernia was also detected. So basically, that's the problem I came to you with.
Let me add and remind you again that we always communicate with patients off camera, that this is normal, anything can happen, and basically we explain what the patient can expect. We have 2 MRI studies, one from the 5th month and another from the 4th month. There is a positive trend, I'll say that right away. Alla underwent treatment at the clinic, at the center. She underwent physiotherapy and therapeutic exercise. Was there anything else?
That was all after the treatment.
Did you do low-intensity magnetic therapy?
Yes.
Did you just feel warmth? Did you feel anything different?
No. Also laser therapy and acupuncture.
What kind of laser?
Unfortunately, I can't remember which one it was.
Alright, did the doctor move the laser or did he just place it?
He just placed it.
He placed it, so that means it was a low-intensity laser. Well, in any case, to be fair, we have a high-intensity laser, which is a different level and format, so to speak. But essentially, their purpose is more or less the same. To reduce the inflammatory process, swelling, and in this case, of course, to promote resorption and restore the disc. Yes, and by the way, don't confuse it. A disc that has worn down cannot be restored. Unfortunately, surgery will be needed in the future. That's why we're not talking about cases where the disc is being worn down, deteriorated, or eroded. This often happens with injuries, for example, when a person falls from a height. For instance, we had a patient. He fell from a height, I don't remember which floor, but somehow he ended up breaking his heel bone and had an extrusion, a large extrusion. In general, it was clear from the start that the situation wasn't ideal, but we prepared the patient very thoroughly for surgery, We performed the surgery and the next day the patient was already walking on his own. Yes, it was difficult for him to walk, but he was walking. That's how well we prepared his muscles. It's really the patient's achievement. You remember, right, Anton? We worked with the patient on an inversion table. That's when you lie with your head at a slight downward angle. I'm not particularly fond of it because you can really feel the pressure in your head. So it's very good with traction. And we also work, as you've seen in our videos, with an inclined board. Let's get back. Sorry, I'll be jumping back and forth. There was physiotherapy, magnet therapy, laser therapy. Was there anything else?
Acupuncture.
Oh, yes, there was acupuncture therapy, by the way. Did you have any tingling sensations, pins and needles in your hands or fingers?
Let's put it this way. There were painful sensations throughout the whole body, so it was hard to identify pain only in the hands.
Sleep. How was your sleep?
Good.
So your sleep wasn't disturbed?
No.
That's good, because I've had patients with hernias who had to sleep sitting up. Yes, because when the patient lies down, the hernia shifts and presses on the peripheral nervous system, and the upper limb, the arm, starts to hurt terribly. Good. Physical therapy. Now, well, yes, getting ahead of ourselves. Where are we running to? I don't know. It's just a phrase that sticks. Our patient is a trainer.
Dance, stretching.
Yes. Group classes.
Yes, group sessions.
Yes. Ala leads, so to speak, group classes in general. She works with patients, with people. That's right. And to this day, it's the same. Ala didn't go through treatment with us at the treatment center. So in any case, I would have given recommendations on an A4 sheet, like avoiding unnecessary jumping. I don't know how group classes are, whether they're active or not. Yes, well, that means they jump on trampolines there, all of that is included. Although, to put it mildly, that's not very good for the spine. So, about Ala, I'll explain, okay? You don't mind?
Yes, of course.
The first MRI, when Ala had an exacerbation, showed a hernia at C5, C6. It was 0.4 centimeters, that is 4 millimeters. By the way, I've always wondered why some people write it in centimeters, Anton. So, after the treatment was completed, exactly 1 full month later, Ala's hernia had remarkably been reduced to a size of 3.3 millimeters. So, well, that's positive progress. Right. And yes, there was a slight stenosis of the spinal canal in the cervical region. Ala also had an MRI of her lower back, but there are only small protrusions. In general, nothing serious. But there are some minor issues. So, how are things today? How is the physical therapy going? Can you, just like off camera, give a little smirk?
I'm not doing it because nothing bothers me. I just follow the usual rules. The doctor's recommendations. When working on the computer or phone, I try not to strain my neck so as not to create static tension, right? Well, so that it maintains the correct anatomical shape and position. Not to bend or extend it too much. As a result, nothing else bothers me.
Is it working?
Well, sometimes I have to remind myself.
I see. And before bed, how about then? Without your phone?
With my phone.
How does that usually go? Do you usually climb onto the pillow?
I generally try to do that, or I have a very specific type of orthopedic pillow. One that is designed to carefully support and maintain the natural anatomical shape of the neck.
Yes, we've heard about it. It's called an orthopedic pillow.
Well, I don't know how true that is, but for now, nothing is bothering me.
Well, whether it's true or not, the fact is that it really does follow the anatomical curve of the cervical spine, the normal physiological one, but the thing is, you also need to choose the right one. Where we buy them, there are usually specialists available. I mean, in chain stores. I believe that these are usually orthopedic salons where there is often a doctor, a traumatologist, or an orthopedist. So they help you along with a consultation. Obviously, the bigger the problem we have, for example, if the neck is shaped like this, the larger the size might need to be. So it needs to be selected accordingly. There is even a special ruler, a level, that measures the length of the neck. Well, that's if you really get into the details. So that's how it is. We have to give a minus for the fact that the patient is not doing therapeutic exercises. But for the positive progress, for the fact that the patient has undergone treatment, and as of today, in this condition, everything is quite good. But I'll say right away, therapeutic exercises for life, it comes... Well, actually, if Ala is still doing group classes, sometimes she trains in fitness. Even the trainers themselves come from fitness. Generally, they're all fit, everything seems great, everything is fine, but with a large hernia, especially in the lumbar region. As a rule, these are guys. They explain that you can't lift weights. Yes, we start treatment, everything seems fine. But the point is, when we do therapeutic exercise, we strengthen completely different muscles, not the ones that fitness trainers usually focus on. With Allah, you can actually talk about this directly. Allah, what is the purpose of coming to the gym?
Everyone has different goals. Some people come to gain muscle mass, others come just to lose weight and tone their muscles. So, in other words, everyone's goals are completely different.
But can we say that, in general, it leans toward aesthetics after all?
Actually, no. Although, yes, many do come for the aesthetic aspect, to look good, yes. To sculpt their body, their figure, through building muscle. But lately, a lot of people have been coming in with a specific issue, for example, to strengthen their back muscles. Nowadays, many parents are bringing in teenagers from the age of 16 who have these kinds of problems. So, for the most part, people are now coming in with some kind of medical diagnosis or problem in order to alleviate that issue.
When our patients finish their treatment, that is, the resorption has been successful, we've managed to contain the hernia, we provide them with our set of video exercises and recommendations, including what they should avoid doing. It's preferable because it's easier this way, rather than when the patient starts listing things like, can I do the pectoralis major? Yes, you can. People say, we have to go, but why? Of course, from what I can see, the person is doing quite well for themselves, so I don't really know. Maybe things have really changed significantly by now. But our goal is to let the patient go with this package because I don't know where they'll end up or who they'll see next. But one of the main recommendations is to definitely work with someone who will be there for you. I am here to supervise you, especially when it comes to your time in the swimming pool. Because it turns out you really need to learn how to swim properly, and not just focus on keeping your hair dry. So, what do you do at night? Let's digress a little, I'm just curious. So, a mother brought her teenager in. Do they come with a referral, meaning with a specialist's conclusion, or how does it work?
Personally, I don't work individually with children who have special needs. For that, fitness clubs usually have special staff qualified for this kind of individual work. These are gym trainers. They are not doctors. Usually there is a doctor present in the gym who monitors the latest results. When a new client comes to the club, a specific trainer is recommended to them for individual sessions. Unfortunately, we don't have this in group classes. People simply decide for themselves whether they are healthy enough to attend them.
In general, your rules are that it's up to the individual to decide.
Well, of course, we monitor very carefully. For everyone who comes to group classes, if we see that someone is feeling unwell or experiencing discomfort during the workout, of course, we then remove them from these classes.
Yes, by the way, let me add one more thing. The most important rule is not to do anything through pain. That's a basic rule. The body isn't stupid, it gives you signals. Well, it's like when the check engine light comes on in a car and it limits you. It's basically the same thing here. There's no need, excuse my language, to force your body. Alright, good. Well, listen, after hearing Allah, I would definitely go to such a checkup myself. Alright, good. So, in principle, we're ready to move on to our examination. Let's take a look now. Well, by the way, according to the description, I didn't find anything. Some kind of scoliosis. Well, it's actually here, and you know, when a patient comes in, first of all, the age, can I say it?
Yes, of course.
Born in 86. Year of birth in 86. Born in 1986, I mean. And with discomfort, with pain, well, honestly, scoliosis doesn't matter here anymore because scoliosis isn't treated here. Of course, we can, so to speak, adjust the curve a bit. We can correct the deviations, reduce them, but that, so to speak, involves blood, then anabolic steroids, and all sorts of things. It's a very, very, very lengthy process. So when a patient comes in with discomfort, with pain, with certain complaints, and for an examination, naturally, we do what we, meaning MRI doctors, do. They investigate the cause of the pain or the source. Alright, we're moving on to the examination. Well, ladies and gentlemen, we are ready to proceed with the examination. If you want to watch the full video, you can follow the code or the prompts. YouTube does not allow these kinds of videos. Those are the platform's rules. So please proceed. Well, we are ready. Because we recently had a complex surgical intervention involving the thoracic region, we are going to have to work a bit differently today. Not quite the way we are all used to doing things. For now, let's begin our session by focusing on the lower back area. Allah, are you feeling completely relaxed and comfortable right now? Let go. It's not helping me. Alright, the goal is to relax, that's all. Sent. Let go. Here we can work on the lower thoracic region. There are many manipulations you can see on the internet, but their purpose is always the same. You can work with the thoracic region, standing, sitting, lying down, on the side, any way really. In general, there are many variations. Why do I always work lying down? The patient is relaxed. He is lying on his stomach, which is the most relaxed position possible. That's why this is the standard classic approach that nothing else can surpass. Hello there, please don't be afraid. Did it pop?
Yes.
Are you happy?
Yes.
Now we will move around to the back, over to the right side. Let's turn over. Can you...
Put something under my head?
Yes, absolutely. Not only is it possible for you to do so, but you really should place a supportive pillow or cushion under your head. Let's turn the head as well and relax. The other side. Now slowly turn over. Turn your head to the side as well. And just try to relax completely. Good. Start by lying down flat on your back. Take a moment to comfortably adjust your bra. Alright, now let's move on to the thoracic area. Okay. Just take a deep breath and relax. You don't need to worry. Let go. Good. What was that?
A crack.
Stop hugging yourself. Did you like it?
Yes.
Slowly turn onto your left side and then gently sit up. How long have you been working as a fitness trainer?
About 2 years.
So basically you started after the surgery, right? Yes. So, did you feel any discomfort after the surgery when you were working out?
The first 3 months.
After how long was that?
Physical activity was prohibited. I'm turning over. After 3 months, you can start training, giving a small load to the upper shoulder girdle. The first 3 months were comfortable.
So, first, we gently clasp our hands behind the head and then slowly open the elbows wide. Now, carefully bring your head down. Towards me. Let go. All right. Let's move on to what we all basically gathered here for. Why? Antoine, I guess you're almost at the parking lot by now. Bruh. Don't cross your legs. Excellent. Well, how's Lena doing so far? Well, it's all clear. So, Alla, are you ready?
Yes.
Relax.
Subscribe.
Lean forward, relax, come on.
Please subscribe to our channel and leave a comment down below to let us know what you think.
Otherwise, he's telling you. Alla, lie on your stomach. Head on your chin, arms along your body. Can you do it?
Yes.
Excellent. Relaxed. More. Good. It's tensing up. Turn over onto your back. Now we're going to do decompression. Get ready. All right, we're ready. Just a little bit, not too much. Didn't let go. So how are you feeling?
Everything's great.
All right, now we're going to do a quick test, so to speak. Let's check the hip joints. The task is to completely let go of your leg, relax it. It's important to understand here that this person works with a fitness trainer, meaning they spend a lot of time in the gym, and possibly there's also hypertonicity present in the pelvis, in the pelvic area. But here, by feel, there's a block. I'll go back there now. Relax. What do you feel?
My skin hurts.
Where am I pulling?
Probably because of the friction, yes.
All right, okay. Relax. No, everything's fine. The joint is moving. I'll stretch a bit here. Other leg. Just relax. Well, you can see for yourself, this is already the maximum, and as I understand, is there a block or not? When I go further, it's already clear. The joint starts to stretch, and I can feel the movement, so everything is fine here. Alla, turn around and get onto your forearms like in a plank, but don't lift your pelvis.
Facing this way, right?
Yes. Elbows together. Bring your elbows together.
Yes.
Yes, that's correct. Look forward. Relax. More. More. Good. Well, Allah, you can exhale now. But for today, we're done.
Thank you.
You're very welcome indeed. Now we will conduct a comprehensive control test to see exactly what has changed and what has remained the same. So, if you would like to watch the full video in its entirety, you can scan the QR code displayed on the screen right now. That is everything we have prepared for you today. Allah, say a few kind, so to speak, animal-friendly, polite words. Please give some feedback to our viewers. Did you like it or not? Just say it as it is.
First of all, thank you very much. I really enjoyed your session. Thank you for explaining everything in detail and showing each action with a thorough explanation. As for me, everything was great. I liked everything. Thank you so much.
How are you feeling?
Sorry, what? About
How you're feeling? About...
how I'm feeling, everything is wonderful.
Good. As they say, short and to the point. Brevity is the soul of wit. Yes. So thank you so much for watching until the end. Be sure to subscribe and leave a comment. Send it to others, neighbors, brothers, sisters, to anyone you think needs it. In short, hugs, lifted up, put down, let go, and kissed. All the best. Until next time. See you. Antoine, or you. That's all. Bye. Bye.
Bye-bye.